reached out to Aaron and told him that I really thought there was something that we could do to really bring healthcare to people of Michigan in a different way. Aaron is one of the most authentic people I have ever met in my life. And as I said, he's also one of the smartest. So he has the ability to really inspire people and bring about change and really be mission driven. From a healthcare perspective, he's worked in areas like artificial intelligence, and he's led one of the largest health plans in the country. There's no one else that I would rather work with on this endeavor.
I knew that Rick was someone that I always wanted to work with, and the opportunity to bring our shared experiences together to do something really meaningful for the market and people that we care about, it was just an opportunity I couldn't pass up.
I met Aaron about 7 years ago, and one of the things we found is that although we have very different backgrounds and expertise, we actually view the world very similarly. Both of us believe healthcare needs to be more affordable, and both of us think we can actually make a mark in making this world a better place.
I knew from the moment that I met Rick that he is someone who does not take no for an answer. There are some people who are willing to think different. Rick thrives on thinking different. Rick reached out to me and said, I'm thinking about starting something new. Here's my idea. I really couldn't say no.
I didn't really have a fully formed idea, but what I knew was that based on the experiences both of us have, there's an opportunity here to better connect local employers to the providers that are taking care of their people, both their employees and their families. So I reached out and shared that I was going to start this thing and that there was really only one other person that I wanted to do it with. And that's what led me to make the first call to Aaron.
And I remember getting the call from Rick, and it was very clear that you had a thesis on the problem that you're trying to address, which was, I've been supporting employers for my entire career. They are still challenged to do the things that some of the larger employers may have access to. And can we think about ways to bring new offerings and new solutions to that market?
I had this central idea that providers, employers, agents, and brokers could work in a more collaborative manner, in a way where all of their interests were aligned to actually improve quality, improve outcomes, and really drive down the total cost of care to make healthcare more affordable. But that's just a conceptual idea. And the great thing about working with you is you're a doctor. You actually know how to architect that in a way that really drives all of those. So when I reached out to you and said, hey, how would you do this? Your idea was brilliant.
Start with behavioral health and primary care as a foundation. And then you start to think about, well, what are the high cost things that have meaningful impact on outcomes for patients and drive spend, and start to find aligned partners in spaces like orthopedics care, oncology care, infusions, and start to create a bit of an ecosystem of like-minded provider partners that want to work together. They understand the benefits that patients actually have. They understand who else is working alongside them. And you start to create this ecosystem of like-minded people who really are there to support patients and the employers. So that was the thesis. And you said, well, let's go see if anybody's willing to talk with us about this.
I remember saying to you, how about we just go meet with a couple of the local health systems, independent providers, and say, we have this idea of how to build products together with you and see what comes of it. But also, there's one thing we want to make sure that we weave through all of these products, which is how do we make it as close to free, if not free, as we possibly can for the people using it. The whole idea really underpinning everything we're doing here is how do we make healthcare more accessible and significantly more affordable for the people who use it by creating better relationships by those who finance it.
What I was excited about is the ability for us to start to create an avenue for those employers to have a collective voice.
Yes.
And the providers who are really eager and willing to work with those employers to also have a collective voice.
And the question I get the most is, well, what does your company do? And I think I would take everything you just said and summarize it in that we are the market's first design studio architecting the way healthcare should work for the people of West Michigan.
To bring like-minded employers together, like-minded providers, like-minded benefit agents who've been looking for solutions for their customers. And what I have been overwhelmingly pleased with is the interest and engagement from the provider community who are saying we've been waiting for the opportunity to do this. We haven't had a mechanism to actually bring employers together collectively to actually work on these things. And by the way, we're only one piece of the puzzle. we need other like-minded providers who are filling in those other components that we talked about to actually come together as part of this.
It's been cliche for what, 2-3 decades now to say healthcare is too expensive, costs are rising too much, this is unsustainable. I actually believe it this time. I think employers actually feel that way. It's not just impacting healthcare spend and their overall business, it's actually leading to reductions in force. It's leading to not being able to hire. And when you look around the communities of West Michigan, many of them cannot sustain this cost. And I think it's now time where they're saying, you know what, I'm willing to do something different. And if there's a coalition of like-minded employers channeled through a company like Manifest that can do this on my behalf, I want to be a part of it. And our ability to unite those two sides of the healthcare ecosystem, I think, is unique to what we're doing at Manifest.
What we've experienced is there are a lot of providers that are willing to do this. A lot have already started to dip their toe in this space, but they don't necessarily have the ability to kind of package these things together, to think about how their component of care fits in with everything else, and then to translate that back into a consolidated offering that is digestible for an employer. So being able to be that chassis that allows those providers to bring all these solutions together and productize what they do is very unique.
The other cool thing about how you're building our products, an employer does not have to choose between their existing health plan relationship and the products and services that we actually are building. They're able to coexist with their current carriers and the current health plans that are providing the totality of their services as a health plan. It's really easy when you're a startup to say, I want to disrupt everything. I want to change how everything's delivered. No, we just want to make it incrementally better. So working with us does not require you to make massive decisions on behalf of potentially tens, hundreds, or thousands of your employees. It allows you to just say, I have a different perspective on this type of care, and I want this entity, Manifest, to help me facilitate that in a better way. If you're an employer, if you're a provider, if you're an agent, a broker, or frankly, if you're just anyone in West Michigan at the moment who wants to see healthcare delivered differently, join our mission.
We are looking for other like-minded people who want to come along for the ride. And I do think it's a mission, and we really want to create this collective. So I'm eager to find those people who want to reach out and work with us.
We have our first event on July 30th, which again, we're bringing together providers, employers, and agents to just talk about the big problems in healthcare and what everyone's doing about it, just to start to create a sense of community. And I think there are a number of different ways in which you can participate in that as well.
And look, we don't have all the answers figured out yet. There's a lot that we're still working through, but I think we've got enough belief in some of the core tenets that we've started to design around. And now it really is that involvement of the employers, the providers, and their agents to figure out how do we really bring this to market in a way that's going to work for everybody.
So join us.
And let's build something better together.